All right, all right, all right. Welcome. Thank you for joining us for Engage and Adapt. We're going to get started here in a few moments. Um, while we're waiting, please feel free to head into the chat and tell us where you're coming in from. We seem to be having a little bit of technical difficulty, so please don't mind that for the current moment.
Also, as we're waiting, I just want to, Chad, you have such a great announcer voice. So I'm already really excited about this conversation.
Thank you. I appreciate that.
I feel so official.
All right, we have Tyler coming in from Lewisburg. Thank you, Tyler, out in West Virginia. Marie coming from Doylestown. As you can see, you're getting a quick preview of what we're going to discuss here today. Please, again, feel free to introduce yourself in the chat. If you need to grab any water, make yourself feel comfortable. We want to make sure that you're taking care of your needs in this moment. We know there's a lot going on here at the beginning of the year. Looking forward to our conversation with Reverend Moya as well as Lauren Reliford, who's joining us here. Um, so we're going to get started in just a couple of minutes here. Um, all right, we have folks coming in from McLean, Mary, Caitlin from Boston, uh, Jacob in DC, Grace out in California. Appreciate you joining us from the West Coast. I know it's a little early there. Otsego, Michigan. All right, we got folks coming in from all over the country. And we are getting ready to start here once we get back to uh our starting screen here. My name is Chad Stanton. I'm from Dallas, Texas, originally, the political director here at Sojo Action, and currently in DC. Looking forward to our conversation. Hopefully, we'll be able to really dig into what's going on with research funding, federal funding, and a lot of the changes that are happening, some of the impacts. We know there's a lot going on right now throughout the world, throughout the country. There's a lot going on with immigration in Minneapolis. Want to make sure we're thinking about them, lifting them up in prayer. We know there's a lot going on internationally with Venezuela and other threats around the world. Some of the things that we're doing, want to make sure to lift that up and speak that into the space. But we also understand that there's also a lot going on domestically, and that includes how we're going to take care of ourselves and how we're going to make sure that we are paying for the things that we need. So really looking forward to our conversation and really appreciate everybody joining us. And I'm going to go ahead and introduce Reverend Moya, and we can jump right into our conversation here.
Awesome. I'm Reverend Moya Harris. I am Senior Director of Programs here at Sojourners, and I'm really excited to be here. This is an important conversation. I'm a retired nurse, so research and health is always important to me. Um, and I'm excited that I have colleagues that I'm working with now and a colleague that I used to work with. So Chad has been such a wonderful person to work with this past year in social action. And Lauren used to be on the social action team in the past as the director in the same position. So it's like, oh, it's like bookends. So I am thrilled to welcome Lauren Reliford, MSW, to our conversation today. She is a passionate political social worker dedicated to advancing whole health, body, mind, and spirit, for Black and Brown communities, especially. She's very passionate about making sure that people can thrive. She has a gift of bridging social theory and theology and just the wholeness of humanity in the lived experience through it and policy, all of that, put it all together. She has that gift. She Before she was at Children's Defense Fund as the political director, she was the director here, and she's also on the board with the Baptist Joint Committee for the Religious Liberty Council. Right? Did I say that right? Of the Baptist, yeah, something like that. Doing some important stuff, but it's just you're gonna see us laughing a lot because the three of us we're friends too. So it's cool to be able to be in this space talking about important stuff with people that you enjoy speaking with. So let's get started. The first question is, and this is really for the both of y'all, because y'all are the wonks in the room. So I'm gonna be talking to both of y'all. So I want to hear y'all's expertise. Like, so just to set the table, can Lauren, I called you Lo already. Lauren, can you tell us about the importance of health research and what it's done before the cuts have come during this Trump administration?
Sure. And I feel like how many years post-pandemic and I'm still fighting with the mute button. So first, I really want to thank you guys for inviting me back into the Sojo Action space, Sojourner space. Uh, it was a major part of my life and my career. And I just want to say, and I hope you guys out there have been able to just see the amazing work that you guys are doing. It gives me a bit of FOMO, but I'm really proud to be able to say that I'm an alumni based off of the work that you guys are doing. Um, I think from just a basic level, I think research is important, right? It is important for us to understand the what and the why and the how to figure out then what do we do with that and how do we make improvements. And so the best way to think about research, just from a foundational perspective, is research, sort of this understanding of life, how things work, how systems work, what isn't working, is very pivotal for us to then understand and educate each other. So research becomes the foundation for education. It's what we learn in schools. It's what practitioners learn. And then based off of the education, that becomes practice. So people learn about it, and then it's like, okay, now we're going to take what we've learned from this very theoretical standpoint, and we're going to practice it on human beings based off of our understanding. And then that practice, once it's done enough, is like, it may be good idea for us to create policies that ensure that the research and the education become standard policies so that all folks who may be experiencing an issue or a problem get a level of care. I think this is particularly important in healthcare research. I think people say medical research, and that can sound very crazy, but some of the things that medical research have done, I think especially when it relates to children, and as Children's Defense Fund, that's where I work at now. So my lens may be children and youth. But so say, for example, I think the biggest part is how understandings in development, child development, and not just sort of from the pivotal years, 0 to 3, but throughout sort of the life course, then informs the type of services and supports that are needed. So say, for example, we think about Head Start. Head Start is a great program. We've heard about it. Unfortunately, it is not being cared for by people who are responsible for ensuring its protection. But Head Start, the reason why Head Start started, sorry about the Department of Redundancy there, is because there was a basic understanding of what children needed at that pivotal sort of early years. And they created a whole program to ensure that children, particularly children that were low income, who may not have easy access, to early learning, social emotional development programs, had what they needed to make sure that they had the same start as all other kids. So you do see how you did research and how children develop, particularly in these early years, and what the brain needs, then become an actual program. And then it became a policy that, okay, if it's working well, we've taken sort of a theory of children and development, and then we've created a program, and we start to see the outcomes because then we research the outcomes, then we see that it's what's good for the goose is good for the gander. And so we make it a policy, we make it a practice of things. You think also about, again, brain development and nutrition. Part of, like, we kind of know that if you're hungry, it's important to eat. But once people really started to research like how nutrition is important for brain health, then it becomes easier for folks like myself and Chad and Rev Moya to go on the Hill or talk to lawmakers and policymakers and say, it's not just enough to make sure that children have, access to free like meals. They should be free, particularly for people who are lower income or may not necessarily have access because they live in a food desert or what have you, to healthy meals, to make this available for all because it's vital for the brain. Research really, again, gives us sort of a clinical cellular understanding of life. And then that life then informs the ways in which we ensure that people have everything they need to grow up with dignity, hope, and joy. I could go on and on about why research is important. clearly I'm a bit of a nerd about it as well, but I think it's something that a lot of us kind of think about, oh God, we had to write a research paper. And we may think about it with some chagrin, but research is really important because you can't fix a thing or you can't help a thing if you don't understand what the thing or the population needs, who they are, what they've experienced. And so it really is foundational to policy and practice and education and ultimately the well-being, particularly of children and youth.
And I would say, I look at it because I'm working on research now, also the theology that plays into this that you don't even think about. I always think of William Augustus Jones, always your theology, how you view God, your faith informs how you act, informs your anthropology, how you see people, whether what their skin color is, what age they are, whatever, informs what kind of policies or rules or how you treat. And so on this policy level, we're seeing theology inform how people are seeing people and informing which laws are being passed. So just put that
Mhm.
in front of you as we have this conversation.
May
Um,
I just add something really quickly to that as well?
sure.
There's a thing called theoscience, and it's theology and science. And we employ a bit of that actually. Well, you guys, employ a bit of that at sojourners are in faith spaces. So say, for example, let's take 1 Corinthians 12:26. When one suffers, we all suffer. When one shares in the joy, we all share in the joy. That is actually a scientific principle, right? When all children when any child is suffering, we suffer, whether you think about it just from a human perspective, or you think about it from a purely economic perspective. When a child is not actualizing their full potential, then that does have a poor return on investment for everyone, because that means that that child and we all believe that everyone has inherent dignity and worth, is not able to actualize their full potential, not able to live out their God-given assignment. And so it's hurting us all. And so there really is a deep connection between theology and science, or faith and science. I think sometimes people think they're adversarial and one cancels the other. But again, 1 Corinthians 12 shows us that a lot of scripture is actually scientific principle.
Yeah, and
Yeah.
I think a way this shows up in a very practical manner, that I think people can really grasp, is looking at some of the interventions that have come about through research, right? In the ways in which we've been able to prevent or lessen things like birth defects through enriching flour, right? And then when we look at disparities, we can see that because we haven't been using enriched flour for things like masa and tortillas, folks who have a bigger part of that in their diet are still having some of the same rates that we saw before people were putting enriched flour in bread, right? And so just through that simple intervention, just through that simple observation of research, we can see how different communities are impacted by different medical and nutritional research and interventions, and then work really hard to address those so that everyone, no matter what their diet may be, no matter what kind of staples they may be enjoying, have the same ability to learn and grow, and be healthy. And so it doesn't have to be super dramatic. We can always point towards what happened with the COVID vaccine, which was another great instance of medical research and intervention in a very critical moment. And I think it's easy for us to forget how scary and wide spread the pain from COVID was at the time, and just how miraculous the vaccine was in making sure to prevent deaths. So I think it's in ways both dramatic and mundane. Medical research has been critical in building the kind of society we'd like to see.
Yeah.
And that,
Yeah.
yeah, go ahead.
No, I'm just gonna say you go ahead. You go next.
Yeah, no, and that leads me into my next question, into looking at, last year the Trump administration instituted some draconian cuts to grants at places like the National Institute of Health and other research institutions. And I wanted to ask a little bit about some of the immediate impact that we've seen so far, and some of the populations that we've seen impacted the most by some of those cuts, just in the outset.
Yeah. So I'm not, I guess this is a bit cheeky, but like some of us really say, oh, I hate science, I hate research, but like, wow, way to take it to like a whole other level here, right? And I think what's even more frustrating is a lot of these cuts were really just looking for words like women, where research was halted, words like black, words like brown, words like disability, right? And so what I think just writ large, the story of the Doge cuts was that you had a bunch of people who do not have a research background, or at least do not appreciate the fact that research, the whole point of research is to ask and answer questions about why X is happening to what and how, like, what is needed or what is sort of the history of it. Who put a bunch of words into an algorithm and made cuts haphazardly. That in and of itself, like, to is just so beyond comprehension because there is an intentionality with it. And I think when people, one, think about research, they only think about folks in lab coats, with test tubes and such. But research takes many different forms. And a lot of the research that was cut really was based off of new ways of understanding how you reach certain populations, particularly populations that have historically been and intentionally been underserved and underfunded. So I'm looking at Black and Brown, Native and Indigenous populations. And then you have folks within sort of those four sort of ethnic or racial categories. I hate to say categories, but categories who then live at the intersections of sexuality, Black, Brown, queer, Native, Indigenous youth who are also LGBTQI plus, Black, Brown, Native, Indigenous youth who are also living with some form of, disability, right? And so you had folks who were already being underserved by a system who were to some extent benefiting from research, even though the research wasn't perfect, even though a lot of times these populations were still not being fully studied, right? But to an extent we were still benefiting from, are now not getting any interest, any research being funded. So one, you have the researchers that are being hit. If you think about the pipeline. And unfortunately, a lot of the researchers who saw their cuts happening were researchers who looked like the people that were being studied. So you found the targeting of Black, Brown, Native, and Indigenous researchers just by the basis of the color of their skin, their gender, their sexuality. So there's that. That's not, again, a good way to identify what the country should or should not be funding or what type of research is good. And then you had, cuts to, again, not just the researchers, but the money, the full system of research. Research funding, again, doesn't just go to the people in lab coats, right? Research funding, when you look at it, goes to cover the facilities. Research funding even funds the salaries of, the janitorial and custodial workers, right? And so you're not just, again, impacting one person, which shows the ignorance of these people making these cuts. I think they thought that they were hurting one person, but they're actually hurting a whole ecosystem of individuals that support and make sure that what happens at the lab happens at the lab. Then you had different types of research. I know, again, Sojo Action did what we call participatory action research. And that, again, is engaging the lived experience, which is very vital to understanding what research is, because while numbers may not lie, they can be manipulated, right? And so when you're actually engaging with the lived experience, you get a little nuance, you get a little color. That type of research was cut. So what do you start seeing? You see pediatric trials being halted. And again, this is from a children's perspective. You saw the termination of pediatric cancer and brain tumor trials, which also wasn't just the research into it, but part of the research is also delivering these experimental treatments to kids. So there were kids who especially had like rare diseases or rare sort of disabilities who were no longer also receiving treatment, cutting edge treatment that was helping them live better lives, that was alleviating stress on parents. And also some of that research funding went to housing cost. It went to cost of living for these folks. So again, it's not just people in labs, right? There's a whole system. You also saw, and I love that you said this earlier, Chad, a loss of Black infant health research. You saw, again, a lot of research targeted to Black, Brown, Native, Indigenous folks. We are currently continue to be in a Black maternal mortality crisis. Part of the reason why the Black maternal health crisis has become a national conversation is one, there are Black and Brown researchers who have always been doing the work with or without funding, right? And then that research started to enter into circles that, quite frankly, were mainly white led. And then those white researchers became really interested in wondering, like, why are there different outcomes for different people, even if you're living in the same spaces? Think about it as children, right? You can have two kids, same household, same parent, same situation, very different outcomes. And that's what they were trying to figure out is why are two kids in the same system having different outcomes and what does that mean? You saw a massive reduction in infant health research. And actually, I hate to do this, but I'm going to read. But there was a study on the disproportionate number of premature births among Black infants in Detroit that was cut by the National Institute of Health. The study focused on stress, racism, and preterm birth. And even though in June 2025, a judge ruled that the NIH's termination of this and other grants was illegal, you still had a stoppage of research and you had a chilling effect. So a lot of folks who were doing the research were even afraid to come back and do it, right? Then you saw also families of color ultimately were disproportionately harmed because communities who were already facing health inequities, who were receiving services as a result of this research, were no longer getting these services and supports. And not only that, there's sort of a psychological feeling that you get when you already know that the systems in place were intended not to serve you, and you start to get some feeling of being understood by those same systems, and then it gets undercut again. And so there's already major strides that have been made, particularly within the Black community, Native and Indigenous communities, to bridge the gap. And sort of address a lot of the medical distrust that we faced in those communities that is going back like not just years, but decades, right? Those relationships that have taken decades to form, that trust that has been taking decades to form is now no longer there. And so ultimately that is going to harm multiple types of research if and when we ever get to a point where the government realizes that it's okay to study, because they no longer have those connections. And you can't study a population, you can't study a problem if you don't have some connection to it.
Yeah, no, and I think that's a really important point. It, when we talk about policy in politics, I think we often fall into the trap of trying to imagine that we can turn back the clock, right? Like things are bad now, but if we turn it around, we get the right people back in charge, then we can go back to the things that we were doing. But in that interim time, you have people who have totally, fallen out of the system, totally lost interest. When we're thinking about researchers and people who are going to be working on these problems, if you're somebody who's coming from a low-income community, you're going to be more hesitant to join the field if you know that, funding is not as steady. Your salary may not be as steady as you may have imagined, and as you may need if you don't have the same social supports that other folks may have. And so, every day that this funding isn't flowing is another day that somebody decides that, I'm going to go do something else. This is important, but I can make money by, going to be a doctor or whatever the case may be. Um, and then that doesn't even begin to work into the human toll of people who are suffering. You cannot, refund someone's suffering even if it's for a day. And so, I think that's something that we really should center in these conversations is, you cannot go backwards, and we will have to find a way in order to move forward to repair the harm, but it won't be a restoration of exactly what people may deserve. Um, sorry, Moya, go ahead.
No, that was good. That's good. And which leads me to this notion of we have to be able to adapt because we can't go back. We've got to adapt to the context and where we are now so that we can even look past today. We need to be planning what's going to happen even with another administration or whatever. What do we want to see when we get past this horrible moment? Because we don't want to stunt the vision of where we want to go. Um,
Do you mind if I add one quick thing?
yeah.
Sorry. This is what happens when you put people in the room that like each other and do the same thing, but are also really brilliant. Chad, I had to give you like all your points because you cannot refund people's suffering.
That'll preach.
Sir, okay.
I'm writing that down.
But one of the things I think is really important for folks to know is, and I think that this is sort of just a broader like funding thing that like really gets me, is that people think that like, okay, it's cut for this year and then we can go back. that's not how it works, particularly when you look at sort of the longer term. First, the way that research is funded in the United States, it is unfortunately a crabs in a bucket mentality. You find a lot of particularly like disease specific or condition specific organizations who really like should be friends, right? Find themselves competing over a limited source of the pie. And so every year you see organizations representing again different populations, different disease conditions, so on and so forth, literally trying to figure out how to get as much money as possible from this small pie, but knowing that you getting got someone else is getting a smaller piece. So that is problematic in and of itself. But there was a point of time, I'm going to bring us back, but in 2010, lying, maybe 2011, 2012, there was this thing called sequestration. I'm going to use a very unscientific term. It was trash. And so essentially what happened was Congress at the time decided that because they couldn't come up with a budget, because they couldn't do appropriations, if they didn't do it in a certain amount of time, then over the next 10 years, they were going to enact a series of cuts, right? And so they were going to say, okay, we'll cut, and this is just, it's not accurate, but giving an example, like we'll cut 10% the first year, 5%, 5%, 5%, 5%. So when you already have organizations and populations and communities that are fighting over this very small percent of research funding, I know we think about millions and oh my gosh, that sounds like so much. Our defense budget is in the trillions. It gets its own piece. And what we see in the defense budget is only like a part of it because there's this whole thing called a black budget. And that is sort of like the super top secret stuff that we don't even know. So who knows how much this country is actually funding, like spending on defense. So if we can spend on a bomb, then why can't we spend to figure out why Black women are like disproportionately dying in the country, regardless of socioeconomic status? So there's that. But our funding has been disproportionate and has been, and again, unscientific trash for a sequence. And what happens is, think about it this way. If you start off and you say, okay, we've given, child cancer, for example, an additional $100 million this year, that's great. But if you have defunded us to the tune of $1 billion over the past 10 years, that 100 million is piddle in a bucket. And so we're not just talking about Doge here. We are talking about a chronic pattern of underinvesting in research that is causing tensions, that is causing disparity mindset, that is causing crabs in a bucket mentality amongst diseases, which then means certain populations that aren't at the status quo, cough, cough, Black, brown, Native, Indigenous folks, folks that identify as queer, folks that are, lower income, folks that live in rural areas, really, really end up getting whatever they can get because more often than not, and too often, they aren't fully represented at the table. So I just had you guys said that, and my right brain was like, got to put that out there. But yeah, it's not just a Doge thing. Like this country does not understand the value of research and how it informs all the things. And again, take that up with your 11th grade science teacher. Like, don't take it out on the entire country.
The system was broken. So it sounds like we have an opportunity since the system is broken and we need to find ways that we can supplement or find other ways, backdoor ways of getting this research done. Like I saw the other day on the news that there was a young person that was cured of sickle cell up in New York. Like that's major. And that was done, so that research was done before this year. Like they were doing this research. And that means a lot to me because I've had at least 3 aunts or uncles that have passed from sickle cell. And it's like you think about all the diseases that are specific to different populations that are just like cut this off. So what is it that the faith community can do? Because I mean this conversation, we could talk about this forever. What can we do as faith communities, churches, nonprofits? Because I even think about, like you mentioned, our participatory action research. That was basically us going into congregations, talking to caregivers and pastors and preachers that deal with young babies and find out what they needed and then put it into a report. And then that you take to lawmakers to say, this is what we need in our communities. So that's just one example of what could happen in churches. It's like we have something we care about in the community. Let's look at a population of it, see how we can, maybe we get a small grant, from somebody maybe like Sojourners, I don't know, that's looking at congregations that take care of children 0 to 3, and it adds to this research bucket so that policy can be done. Are there any things that we can look at? I wasn't trying to make a plug there, but I was.
Nose game. Chad goes first.
Okay. Yeah, no, I think particular touching back on the point that Lauren made earlier around, research isn't just people in the lab coat looking at a microscope, right? And the point you just made, Moya, is a lot of this research and a lot of the research that's being targeted is the research that is meant to surface a lot of those things that are not normally talked about or seen within our communities. I think we can do a really good job of making sure our churches are a welcoming space for everyone so that we can have a good idea and have folks feel comfortable making visible the things that they're suffering from so that we can lift those up towards the people who are making decisions. I also think we can encourage, particularly because churches, religious leaders have a prominent role in the community and are trusted messengers. Reach out to legislators directly in order to try and make sure that some of this funding gets restored. I know there was a ruling on the NIH that kind of halted some of those cuts, but again, when we're looking at the overall pie, there's going to need to be more state funding, more state investment in research. Folks are going to need to see different sources of funding in order to feel comfortable getting them back into the field, right? I think there's going to be a lot of hesitancy before people feel comfortable trusting that the federal government is going to be able to provide all of the funding that they need. And with that in mind, I think we'll have to be creative, and I think the church will have to be a really big part of that when it comes to thinking through ways we can build a more durable system so that everyone can be represented and folks can feel comfortable getting into the field, and so that we can build the technology and the understanding that we need in order to make sure everyone can thrive and live in the way that they need to. Um, hopefully that made sense, Lauren. Do you?
This is the problem with like going after like the Star Act. You're like, dang, how do I top that? But I really appreciate you saying that because you brought up a lot of points that I just didn't have down. And so I love that you specifically talked one about how churches are sort of welcoming spaces. I will also say that how do you um, as the turtle trick the hare to win the race. And I think because many decision makers in this Congress, at the state and local community county level, in this administration, love to talk about faith, and they are just warriors for Christ. Which one is a different story, but um, I think to the extent to which you as a church can host, listen, like understand your communities. So understand what the needs are. Host listening sessions with members of Congress. You don't even have to have them come to you. You can hop on a Zoom and say, these are the things that are going on in our communities. And these are the types of research that like we cared about. Organizations like Sojo Action, I'll put a plug for Children's Defense Fund. Of course, we're highlighting these things. So being able to educate yourself about the types of research that was going on. And then saying, wow, these issues are coming up in my community and I see how they're going to be disproportionately impacted. Like, let's talk about the reasons why we need to keep them funded. I think there's also just, in the absence of federal government funding, I love, Chad, what you said. A lot of states are now and counties are now going to have to shoulder the burden. And if anyone does state or county level politics, they ain't got no money. And so how are we then? And you see a lot of philanthropy, so a lot of large organizations and funders going to what they call place-based funding. And so how are you also encouraging, or if you work in this space, encouraging funders to, one, make sure that in the states they're funding the types of research that you know are important. But two, if you happen to work for them, making sure they go there. I think three, one thing that we can do just in general, and this isn't necessarily faith specific, but we should understand that there are a lot of communities and a lot of social and cultural problems that have existed that are either underfunded when it comes to research or just not funded at all, because we have a problem with caring about Black, Brown, Native, and Indigenous people. And so there are communities, there are small organizations at all levels, county level, state level, national level, who have been doing the work and finding the money. And so support them. Children's Defense Fund is a national organization and we have support, but there are organizations like National Black Child Development Institute who have done seminal research on 8 essential outcomes for children, who have also introduced an Afrofuturism sort of concept. And a lot of this they're doing based off of what they can, so support them, right? Giving Tuesday is a thing. Maybe forego, and I'm going to sound a little bit like some of these people. They're like, do you need $8 for Christmas? But maybe forego the Amazon order to donate to them, knowing that they're doing the kind of research and actually reaching the communities that you're probably in, or the people that you serve, to make sure that their research is lifted up. Because even if we replace the levels of funding, we're still perpetuating a status quo that is not necessarily helping or looking at these problems. And again, quite frankly, if you are a population that has always been intentionally ignored and intentionally underinvested, you found a way to make the thing happen. And so as things are getting restored, you should be urging your members of Congress to look at communities who have been doing the research and who understand their populations and making sure they're at the front and center, because where the burden is happening the most, the system is the sickest. And so again, when one suffers, we all suffer. When one shares in the joy, we all share in the joy. And I did also want to point out that, like, this is, I'm not just saying this as a Black person, as a Black woman, someone who cares about her community. Again, I'm going to go to the stats. I've got a little COVID brain, so that's why I have to read. But the National Institute on Minority Health and Health Disparities. So this is a national institute. So the National Institutes of Health is actually a huge sort of system. And there are different institutes that focus on different sort of diseases and different populations. So there's an institute on infectious diseases and allergies. There's an institute on heart and lung disease. There's an institute for almost everything that you could think of, right? So you have specialists that are focusing on those things. But the National Institute on Minority Health and Health Disparities, which focused on minority health and health disparities, lost almost 224 million of its roughly $755 million in grants. So that's pretty much between the inception of Doge and now, they lost 30% of their NIH funds. And if you go back to the top of what we talked about, those funds covered everything from the people in the lab coats to people in the field to the people in custodials. And so again, when you're talking about research, look at who's being hit the hardest and being targeted the hardest and really try to advocate for them, because even with restored funding, we're still going to return to this crabs in a bucket mentality. And so outside of just making sure that we have a robust funding mechanism for research, whether it's federal grants or public grants, they really need to be creating systems of care that focus on people who are experiencing the burden the most to make real actual systems change that makes it better for everyone. Because if the system is willing to tolerate the treatment of XYZ person over here, best believe that means that they will tolerate it happening to you if you ever find yourself in that situation. And I think a lot of people are finding that out now, like, oh, wait a minute, like, I just thought it happened to these people, but it'll happen to us. And so
Yeah, no, I think that's very well said. I also want to make sure that we give folks the opportunity. We have a Q&A. There's also room in the chat. If you have any questions, please feel free to put them in there. Um, and I think another thing that, not to take it too political, but we have to demand from Congress that, they find a way to make it so that when they allocate funds, that they're being spent in the proper manner, right? So that they're not just being held by fiat by the executive. And so we have to really push Congress at the federal level in order to try and find a way to answer and prevent rescissions, which is like a very technical term, but it's more or less when the president decides or someone in the executive branch decides we're not going to spend the money Congress says we were supposed to spend because we don't agree with or we have a different interpretation of where we think that money should go, which is not constitutional in the strict sense. I think that's going to be a really big, no, it's not particular to medical research, but it is a part of the larger problem as far as people having, I mean, f full faith in the credit of the United States of America saying, hey, if we say we're going to give you $1, then you are going to get $1 no matter what.
And Chad, let me also say that this is not just sort of like an American problem. This is actually a national security issue, right? When the quality of the research that the United States is producing is Timu level, Timu value, right? Um, One that harms the research partnerships that we have with other countries, that harms our standing as a intelligent, sort of well put together, curious country. And so again, it's not just, I want to point out that it's not just domestic research that's being harmed, it's international or global health research that's being harmed. And quite frankly, there's a lot that we can learn about ourselves and life from other countries. Um, and it's just the right thing to do. And so I want to make it clear that like not having sort of a solid scientific basis that's based on real fact and real science versus opinion and speculation is harming our standing in sort of international global space, and it's harming the level of talent, it's harming the level of intellect that comes over here and wants to be educated in our schools, wants to learn about these problems, and wants to learn about again what life looks like over here to better understand how life can be improved there. And so again, it's not like, I think the takeaway here is that it's not just people in lab coats, right? There's ecosystems, um, there's real lives at stake, there's real standing at stake. And so we have to get serious about it. Just because we may not understand it doesn't mean that it's not important. And I also want to point out again the arbitrary nature of things. Like you can like just because you don't like it doesn't mean that the problems are going to go away. You're going to make them worse. And so some of that surely is by design, but research matters because it has improved things. We have, like you said, the COVID vaccine based off of research that started before. Research builds from here. It should not be up for debate, its importance. And I think in the year of our Lord 2026, that this is the conversation that we're having, and not celebrating the types of research and the impact that it's had is mind-boggling and just baffling.
And I just want to put a pin there. We also see it with childhood vaccines now. This whole anti-science thing is catastrophic on children, and it doesn't just keep within our borders. It goes from state to country. Diseases that we have eradicated, we thought were eradicated, are coming back. And this notion of faith and science not being together is dangerous. And I think the church, that's one thing the church can do, is faith leaders can amplify the fact that faith and science go together. That, like you said, there is science within the Bible. Science is just a way of understanding the world, right?
Mhm.
How things work. Oh, the sun comes up and it goes down. How did that, like the stars in the sky, and with all the things, people have been doing science forever.
Mhm.
And we're allowing ideologies to um allow to dictate what happens in this country is going to affect us for decades. Looks like we got a question in the chat, y'all.
Ooh.
Yeah, we have a few. So I want to start at the top from Vanny started with saying get congregations to donate to politicians, donate only to politicians that support research, and start diverting money to research and not the politicians. As a suggestion, uh, um, SA Code 46 says, yes, I think historically various religious groups have developed programs to meet specific needs of the community that were being ignored by the wider community. Thank you there. Karen says, communities are coming together to protect from ICE and Border Patrol, organizing in their homes, and we can introduce an organizing model that's similar around health and nutrition. And then Kaylee asks, what makes it so easy for people to ignore the intersection of faith and science? Which is a bit of a philosophical question, and then I can tackle it, or I can try and tackle it here. Um, I think, it depends upon, and of course, people have really various different ways of approaching faith. But I also think there is often a conflation of faith with kind of an absolute certainty and a lack of curiosity in the world around us and how things work, right? If we can always say, well, that's the way God wants it, then we don't really have to go any deeper when we're asking questions. But I think just I guess personally, I would say God made us curious for a reason. God gave us reasoning for a reason, and so when we're thinking through the world around us and everything that um, happens, I think it's important that we utilize the tools that are given to us in order to try and make the world a better place, right? It's not enough for us to kind of sit back and wait or imagine that all of the answers are going to be given to us. I think we are kind of called to make sure that we're doing everything we can to move in the world in an intelligent way. There's a saying that it's not in the Bible, but if you know better, you do better. If you knew better, you would do better. And I think that it holds true regardless of your faith. And so I think that is one of the things that can kind of be an impediment is that people can feel as if by being curious that they are questioning their faith, and I think by being a little bit more open-minded, I think as we've said, throughout our conversation, I think you can see that they kind of working in conjunction with each other. But I'll let you all tackle it as well.
So first I want to say scripture is everywhere. If you know better, you do better is actually scripture. James 4:17 of the New Living Translation version says, remember, it is a sin to know what you ought to do and then not do it. That to me translates to if you know better, you should do better. So again, listen, and I'm pretty sure in Paul's letters, there was multiple times of him being like, because if you've read the letter to the Corinthians, like he was like, what are you people doing? So see scriptures everywhere. I think a bit to just add on to the brilliant points that Chad made. I think that science, and I say this as a Catholic, science has been seen historically in the church to be adversarial to faith because it seems as if discovering new things, cough, cough, Galileo, like the sun is not the center of the universe, has somehow seen to be a challenge of the wisdom of the church or the wisdom of faith. And I think people have this fear, which again, fear is not of God, right? So let's think about that. This fear of, oh my God, science is going to disprove my faith, which maybe that's not a science problem, maybe that's a you problem. But as you were speaking, I thought about how science actually shows how wonderful and creative God is, right? Science in showing when the science of child brain development, and you realize that the child brain develops in a way in which it's a relationship in which one part builds off of the other and it's a system and there's an order, like God's order. It's like, wow. I sit there in my neurobiology and attachment class, and I sat there with a sense of wonder, like, wow, God, you created this. And I appreciate how science allows me to deeper appreciate how intricate and how like intentional and how ordered your creation is. I think science also shows us then how important it is to then protect these wonderful, like even at a cellular level, things that God has created. Because when we see the ways in which Black and brown children are being already underserved in a relatively robust previously relatively robust system, it should galvanize you, especially as a person of faith, to be like, no, 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 no. We need to continue to understand why God's creations, why children are not growing up with dignity, hope, and joy, so that way we can make sure that as people who, again, when one person suffer, we all suffer, make sure that we are using all of our power to give these children the things that they need so that way they can like actualize their full potential. Right. And so I think when you stop fearing science and you see one, how um, science is just a different way of saying theology or faith in another way, science helps you better understand or really truly see the wonder of God's creation. Um, Even not, from a child example, like I love bees. I think it's amazing how God created this whole system of bees that works with nature. And it makes me appreciate the systems around it, not just the bees, but making sure the flowers are good, like making sure environment, like that is a sense of wonder that I get because science is helping explain why things are happening. And again, it draws me closer to God. Um, I think also people, yeah, I'm gonna stop there because there's a question that like made me think about some other things, but I think that it's um faith and science probably go together real bad in ways that people don't see, but there's just been this really like historical um adversarial nature between the two, and people should see it more as like, wow, this actually proves how wonderful my God is.
That's the thing. It to me, as a nurse, it makes me think of just the wonders of God, right? I'm a heart nurse, and to think of how our heart works, and we have our own internal pacemaker, and it regulates our blood pressure, and it changes when we walk, and the heart rate goes up, and our blood pressure goes up to feed everything, and then it slows down when we sleep, and that ain't nothing but God, right? To be able to create these things that have order and rhythm and patterns and they can exist at the same time. And I think that's the thing. If you read through the Bible, all the things like look at Job, all the things that was happening to Job, and but he still trusted God. But you can trust God and trust the doctor that was made by God, right? Um, there is and Jacob, I love what Jacob says. He I believe in some cases, where to go, that it's not that it's easy to ignore, but a matter of teaching and upbringing. In my case, as an engineer, I was taught to plan, analyze, etc. This is something counter to faith. That's what people say. It was not until recently that I've learned to do my part and let God handle the rest, right? Rest. Because there's mysteries of God that science will never explain. But that doesn't mean we don't trust science. And we have a question. Whoa, and we've got about 7 minutes left. What is something practical we can do as citizens as we witness the research in the medical field crumbling? And I think we have to remember that funding doesn't just come from the federal government. That's one thing we have to remember. Just because the federal government isn't funding it, there's state level research, there local research, there's organizations where funding can come there. It's just the big funding came from the government. So what are some ways that we can as the church make sure that this research doesn't go away? Like not all of it. Some of it, like you said, you can't turn back time. But in these next few minutes,
Yeah, yeah, no, I think again, making our voices heard, reaching out to universities if you're an alumni to a university, if you have a local university that's, a research facility, let them know that, this research is important. You want them to fight for the research that is important to different communities. Doing the same at the state level, legislatively, and then doing so at the federal level, asking folks to continue to fight for medical research. I know Congress is in the middle of some appropriations, so reaching out to them, letting them know you want medical research funded. I know a lot of Congress folks have decided to restore a lot of the funding that was cut, which is a good sign. It's a sign that Congress is, willing to assert some of their priorities. So maybe even, pushing them to take a step further by making it so that the president can't claw that research funding back, could be good. So those are a few things research wise. I think research funding wise that folks can do.
Yeah. I think there's also other levers or areas of influence that get members' attention. And so one, I think just the baseline thing is just to make sure that you feel comfortable enough understanding like what research is, what has been going on. Like every day should be a school day, right? And so maybe make one of those school days about like what is research, what is its importance, and feeling comfortable enough to then be able to have conversations with other folks, and just talk about the values of it. Don't push and say like, what, da, 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 da. Like, this is why research is valuable. Like, and even if it's like, because it helps us understand God, like getting people to buy into the values and the narrative around research as a way to build relationships before you start talking about policies, I think is the best way, because the moment people start talking about funding and XYZ, it gets really political. So let's just have conversations about the value of all of this. And that's what we started off with the top, right? And so we've kind of given you a bit of a formula about this. I think too, understanding that, you know, if, Muhammad can't go to the mountain and the mountain will come to Muhammad, there's also the media. I'm going to do a shameless plug, and in part because you brought up childhood vaccines. There has been a large scale attack on childhood vaccines, which is incredibly unfortunate, in part because while no medical technology is perfect, because we're humans and nothing is perfect, vaccines work. Okay, vaccines work. And the attack on the childhood vaccine schedule has been incredibly unfortunate, in part because it's not based on science. And some of the arguments are, well, why aren't we in the United States following the vaccine schedule in Denmark? Because we're not Denmark. Because Denmark is a different population. It's a different climate. They face different health burdens and they have a different healthcare system. So it doesn't make sense for us to follow the vaccine schedule of another country, because they're not like us, right? As Kendrick says. And so write op-eds, find people in your community or in your church, have conversations. Maybe someone has benefited from research, right? Get them to write an op-ed. Our president and CEO, Reverend Dr. Starsky Wilson, recently co-wrote an op-ed about the importance of vaccines. And I'm going to drop it in the chat. I said shameless plug. I'm going to do it. But what is an area of life that really concerns you, right? You don't have to be an expert on all things research. None of us are here, right? And even researchers have a very specific focus. What is an issue in your community? What is an issue in your own personal life? Are you or someone you love been impacted by heart disease? Do you know a child with developmental delays that, it's like, well, why is this happening and how can we help them? Just do like a little background, find organizations that are trusted, that may have resources. I would say do some reading, but the government is also deleting research, which is a whole other thing. But join in conversations like this to be able to gain enough knowledge to be able to say confidently, like, this is important, and write op-eds. Get folks that in your communities to call and say, like, we really need an actual like National Institute of Minority Health, because we know Black and Brown, Native and Indigenous folks, particularly children, are disproportionately impacted, one, by social and cultural issues, and then two, the research isn't even fully serving them. And I think three, just to the extent to which you can also, again, continue engaging with organizations and urging sort of nonprofit organizations, large ones, to also have these conversations and gather. I think that's also another important thing. I see Moya has dropped it in the chat, but like writing a letter to the editor is as simple as that. And it can actually be incredibly impactful, because I think one of the things that I can say, at least about the Doge cuts, is the level of harm that has been done by cuts to not just research, but Department of Education and all of the other things that Doge has done. A large reason why these court cases have been won is because of stories. right? And so you guys are here for some reason. This drew you to it. Like, what is that story? What is your why for coming in here? And share that. Get on your member of Congress's, like, go to house.gov, look up your member of Congress. Um, and yeah, like, and reach out to them. Reach out to your state and local legislator. Urge them, because again, national federal funding is sort of like, it's nice that we give it, but states and county governments really figure out, okay, this is where the need is, and then allocate it. Also engage with your state and county lawmakers. Let them know, like, we are concerned about this, and urge them to engage with their counterpoints, right? Like, if they're not going to listen to you as a constituent, maybe they'll listen to another lawmaker who is dealing with budgets, who is also seeing the impact. And then connect with providers, have conversations with, doctors, social workers, other folks across, and again, better learn how research is helping them do their jobs. And urge them, encourage them to also speak up and say, without this, this is going to happen.
Yeah, and so we're at the hour here. I do want to make sure to encourage folks to take our webinar survey. It's going to pop up, I think, at the end of the webinar here. I'll also drop it in the chat. Just any feedback allows us to make sure we're serving you as best as possible. And I want to thank Reverend Moya and Lauren, but I'll let Reverend Moya do the thanks. We might be having a few technical difficulties.
Oh yeah. Oh goodness.
Yeah, no, this has been an excellent conversation. Um, and so yeah, I wanted to make sure to say that myself.
Awesome, awesome. Just wanted to let y'all know this is recorded, so you can always go back and grab this information. You will get an email with the recording, and anything that we shared in the chat, we'll share that as well. And just to let you know that the next Engage and Adapt is on March the 10th at 7 p.m. And we'd love for you to join us on January the 6th. Let me share the screen real quick. For Octavia Told Us. So you can learn how to build community when the world is on fire, because it's on fire right now. I don't know if y'all can see that because I got all kinds of craziness going on with my technology. Can y'all see that?
I
And
can, but I don't think I count. So
no, but still, and I just wanted to make sure we lifted up too. We do have an action alert with the ACA tax subsidies that's connected to our healthcare, and that's a great way to also affect our health and our well-being. And it all runs together. But thank y'all so very much for attending. And Lauren and Chad, y'all are brilliant. I'm just so glad that did I say January 6th? What did I say? I saw my husband said something in the chat. January 27th, which is a Tuesday at 6 p.m.
and
I
I
hope
can I just say to my Sojourner Sojo Action family, I am so proud to have been part of sort of the movement that we're building, and I just am so delighted and just so in awe of the work that you guys are doing. Thank you both so much for having me on. I pray that you guys continue to be lit by the Holy Ghost and continue to do the good work. Consider me always a partner. And for everyone else, I hope that your pockets stay fat and your belly stays full but flat this year. May your sleep be peaceful. May your nerves go untested. And in these rough times, because this is heavy, may everyone find the peace of Christ, the peace of God. And when you can't find it, may it find you where you least expect it but need it the most. I'll do it for them. Please continue to follow Sojo Action and all the wonderful things they do. And if you want to gander over to Children's Defense Fund.
yes, because we working together. We always, all three of us run into each other at something. So support the awesome work of the Children's Defense Fund, especially they have the Children's Sabbath that comes out in the fall. Just pay attention to what they're doing. Childrensdefense.org, right?
Yes, ma'am.
That was good. That was off the dome. So thank y'all so much. And we will see you in March. We're doing every other month for Engage and Adapt. Chad, do you have any closing words?
No, I really enjoyed the conversation and I really appreciate everybody joining us. So.
All right. Thanks, y'all. And thanks, Courtney, for being on the back end. Peace, y'all.